Hello everyone, my name is Blakeleigh Delgado, and today I'm going to be telling you about my research topic, which includes hospitals and healthcare in Lawton between 1901 and 1927. And I'll expand on those specific dates in just a moment, but I chose specifically to emphasize Southwestern's history as opposed to like Comanche Memorial. Comanche Memorial wasn't founded until 1948. And so I found those timelines a little restrictive, so I stuck to Southwestern. My grandfather actually works at and operates at Southwestern, so I thought it'd be a fun topic to explore. So, as you guys know, in 1901, when Lawton was founded, there actually was already a makeshift sort of form of healthcare, and it was called the Tent Hospital, and it served at the Fort Sill garrison, basically helping, wounded or injured soldiers. The problem was that in 1901, as Lawton was established, there's this massive influx of people. And because of that, the tent hospital was not equipped to deal with this. So some other forms of healthcare slowly emerged. One of these was Miss Irene Oler's who opened up her house to the sick and the poor and essentially provided some medical care. Now, there was an attempt at a first hospital pretty early on, and it was called the Lawton Public Hospital, but its significance didn't quite reach the height that they had hoped, and it was easily outcompeted by 1907. Now, the reason these two, aside from the population growth, the reason that Irene Oler and the LPH opened was in the wake of a rather disastrous tornado, several epidemics, disease, as well as in general unsanitary conditions, especially at the Fort Sill garrison, which led to dysentery. So in the wake of this, they decided a permanent healthcare institution was needed. And this is where Turner and Lewis come in to play. So in 1907, Doctors William Turner and James Lewis came together, broke away from LPH, and decided to go out on their own and establish a private hospital. And what they did, which is so significant, is that they brought in several local physicians together to work on a board, a health board, and this allowed them to grow significantly and eventually outcompete LPH. Let's see. Get my bearings. So some questions I had that I sought to answer in my research was, how exactly does the hospital operate, pun intended? How did those within its, in its walls, within its influence, what do they do, and why is that important? And then my next inquiry is, who were the patients, and how did they get help? What significance does this bring? So some more historical context. In the 1920s, as hospitals, were emerging more and more in rural communities, they found that one of the big keys to success was a local community needed philanthropic support, and that local community needed to support the hospital itself. Otherwise, it was very easy for the hospital to just kind of fade away, which is the case for LPH. Now, Turner and Lewis, because they brought in several local physicians, and they created several different health boards and organizations, they were able to, to band together to share financial needs, to sort of develop medical practices and maintain, equipment and other medicines. And the main thing is they were able to establish a fair, financial distribution. And this essentially helped the Turner and Lewis Hospital, which was then renamed Southwestern. That's what allowed it to thrive. And so another article that I read notes that one of the great things about in the 1920s, as these rural hospitals are emerging across the nation, is that they're becoming these acute scientific places of care for paying patients, mainly sort of advertising to a middle class clientele. So let's see. There were several ads in the Lawton Constitution, which was a major source for me. And these ads date back to 1907, and they boast of a wonder of modern technology and comfortable conveniences. And this indicates kind of a major shift in the relationship between physicians and their patients. And the reason this is because physicians no longer have to go out and make house calls as much to their patients. They now have a new model where the patients come into them, and this is available because of the the advent of the telephone and these new mechanized forms of transportation. So also in the Lawton Constitution were ads promoting new operating rooms, very sanitary conditions. That was the main thing. Even if they didn't have specific abundance of equipment, they always promoted sanitary conditions, which is you would hope in a hospital. So another major source for me was a book called A Matter of Pride, a 70-year history of Southwestern Hospital. And they commissioned the work done, and because they're very proud of their hospital and their history. And in both the newspaper and in this book, they emphasize the vital role of the nursing staff, in addition to the physicians, but also the education of that nursing staff, and a very specific sort of advertising strategy to middle-class pregnant women. And I'll expand on that in just a moment. So between 1919 and 1927, these mostly volunteer, rural, privately owned hospitals, they had their own educational programs for their nursing staff. So while most physicians, especially in the formative years, had training outside of state, most of these nurses had training locally. And in one such case, Lois Glenn, who became very influential in Southwestern's history, she was a nursing and surgical supervisor, and she graduated from the local high school and immediately enrolled in the Southwestern's nursing program. And within a few short years, she was certified, and then immediately went into work for that hospital. And the Great Plains actually has one of these certificates of a nurse named Ada Jo Austin, who graduated in 1926, a year before my cutoff date. So the reason I particularly chose 1927 is because Oklahoma legislature passed a law then requiring these nursing educational programs to be moved to a facility that had 50 or more beds. And in 1927, Southwestern could only boast of having 22, and that wasn't enough, so they had to kind of give up their specific programs in favor of a more urban, bigger, and facility. And most of these were kind of tied to universities, and this was happening in other places as well. But it did slightly impact Southwestern. All right. Okay, and so this kind of leads to my next inquiry, which was how Southwestern affects the community, how the patients specifically, and what exactly did it do? What services did it provide? And that sounds like a rather obvious question, but medical practices then and their needs 100 years ago don't match up with today. So I just wanted to explore that. So I found a newspaper article in 1910 that, I think, as I said earlier, promoted having an ambulance and the ability to make house calls. and the roles of physicians, able to be kind of versatile and at hand and always ready. So some of the more prominent doctors, Doctors E.B. Dunlap and George Barber, who actually bought the Turner and Lewis Hospital, and they co-directed it, as well as serving on the board, they had this very strict emphasis about operating, and they insisted on infection control and prevention. And let's see, so while the hospital sort of stressed a very middle-class kind of patient paying, specifically to female clientele, they were also rooted specifically in helping the community. They essentially relied on local support, and therefore they had to cater to local needs as well, which, as you might guess, is kind of the role of a hospital in general anyway. But let's see. So Dr. Dunlap, a very prominent figure within the hospital, as early as 1914 and as long as like 1950, had a very strict avoidance of surgery unless it was life or death matter. And this is because surgery was still kind of coming into its own, and these rural kind of communities didn't always have the supplies they needed or the technology, so surgery they were very wary of the surgery. However, they did obviously have to perform surgeries, and some of these included mastoid operations. There were cases of edema, emphysema, and also acute infections. So just to kind of recap what I've already gone through, I wanted to look at the origins of hospitals in Lawton, specifically Southwestern. And I learned that this is rooted in Turner and Lewis, and the reason they were able to survive and the reason that we have Southwestern clinical hospital today is because they very intelligently brought together several local physicians ranging across the whole Southwest region, brought them together and to serve on a board. And because they shared financial burdens, they helped promote for local support, and they gained the community support, they were able to thrive. Also in this time period, another very important factor was the nursing programs, the nurses themselves. The reason they were able to be trained efficiently by the doctors themselves, and then immediately go back into work at these hospitals that they were trained at, specifically helped them and the hospital to grow. And then my third inquiry was, what exactly do they do for the patients? And they specifically aimed at women at the risk of childbirth, and promoted very clean sanitary conditions. They did do a few operations, but in these formative years they mainly shied away from them. And so my conclusion is they were firmly rooted in the community, and sort of this, how shall I say, this bringing together of the board, and they're banding together through thick and thin through the World War I and right into the age of the Depression. It left them with a very quite long and rich legacy and history to explore. Thank you guys for watching. Hope you enjoyed it. See you in class on Tuesday.